Now, South African President Cyril Ramaphosa last week chaired the introductory meeting of the Commission on African COVID-19 Response. President Ramaphosa established the commission after his appointment at this year's 34th ordinary session of the African Union's Assembly of Heads of State and Governments in February. Now, acting presidency spokesperson Tyrone Seale has said that this is in recognition of the crucial role played by President Ramaphosa in driving the continental COVID-19 response during his tenure as chair of the AU in 2020. The commission comes amid various challenges faced by the various African nation states brought about by the impact of COVID-19 on the continent, which includes, of course, increased levels of violence during the pandemic, unemployment and poverty, and according to new UNICEF South Africa U-Report survey, all of these have been exacerbated. Professor Narnia Bohler-Muller is from the Development, Capable and Ethical State Division at the Human Sciences Research Council, and she joins us now to talk about this a little bit more. Professor, good to have you with us on Morning Live once more. Welcome to it.
Thank you very much. Good to be here.
So, Professor Narnia, let's start with your work at the HSRC with the University of Johannesburg. And you looked at how South Africans felt about a range of issues, and perhaps just for context, for the benefit of the viewers and those who may not be familiar with it, which were some of the issues that you looked at?
Well, as you say, it was a range of issues, and we, at the beginning, before the vaccination issue, we obviously weren't probing that, but we were looking at people's experience of the lockdown. In other words, what their mental state is, how they're feeling, whether people in their household or themselves are going hungry. We looked at whether people were willing to sacrifice their rights as a result of the pandemic and to prevent the spread of the pandemic. And we also looked at political trust.
Now, you know, we're talking about President Cyril Ramaphosa, the role that he's played as chair of the AU, and at a time when we were, you know, at the onset of this pandemic and nobody really knew what to do, how to go about navigating a very new pandemic and the world basically in a flat spin. How would you say President Ramaphosa did, and also in terms of leading the continent, his role in that and the role that South Africa as a country has played?
Well, here at home, President Ramaphosa's popularity was very high during the pandemic. In the first round of our survey, which was in April 2020, his trust in the president or confidence in the way that he's handling the pandemic was over 80%. This dipped quite a bit in the middle of 2020, and I think that was around the regulations perhaps to 65%. And then in January of this year, his popularity was back up at a very high 85%. By popularity, I mean that people trust him and that he's doing a good job in terms of handling the pandemic in South Africa. We're gone to the fourth round of our survey, which we started last week. And it's going to be very interesting to see if there are any changes in confidence in the president, because there have been a lot of issues that have changed since January. We're now in the third wave. Gauteng is in a serious crisis. We're back in alert level 4. And so I think some people felt that action was taken too late. Besides that, there are the vaccine rollout issues. So last night, it was interesting to see the political parties responding to his address in that they were very much in election mode. So at the beginning of the pandemic, everybody was standing together. They knew how serious it was, but now there seem to be quite a few political divisions. And I think this would also lead to diminishing trust in the president, which is a pity because we found in our survey that people who trust the president would be more willing to take the vaccine and would be more willing to follow the regulations, the public health regulations that he always refers to. So loss in trust of the president is not a very good thing for us. In terms of the continent, I mean, President Mbeki was the first one who really went into African Renaissance mode. And then this kind of didn't really continue during the Zuma years. But President Ramaphosa has decided, I think, to go back into being part of Africa and assisting other countries. However, here in South Africa, I think that people feel there's a bit of nationalism creeping in, that we should come first and that we should worry about other African countries later when we've sorted our own issues out. But we didn't ask any questions around the president's role in Africa in the survey.
And just speaking to the levels, the ratings that you spoke about, where the president's approval rating was at 85% at some point and then fell to somewhere in the 60s. So looking at that, if you listen to people, a lot being said about bungling in decision-making, how some of the issues have been handled around the vaccine, for example, the social security measures that were perhaps not as effective as people would have liked them to be, the fact that people have lost jobs, they've lost livelihoods, and for some sectors, like the banks, some would say it was business as usual. They wanted their money, in spite of the fact that people were under hard lockdown and lost out on much of their livelihoods during that time. So just in terms of that, in how South Africa has perhaps mismanaged in certain instances the pandemic, did you have anything specific pinpointed in that direction?
Well, we did, but because the popularity was so high, I mean, we had an open-ended question to the president at the end of the survey and messages that people could send. And I mean, overwhelmingly, people were relieved, especially at the beginning, that the president had taken decisive action. But I think that decisive action has somewhat wavered. And because, for example, as you have said, the social grant system hasn't been effective enough. People have lost jobs and livelihoods, but of course the balance between the saving of lives and livelihoods is something that came through in the survey. And there seemed to be a sense of social solidarity where people were willing to sacrifice going out and traveling from place to place in order to stop the spread of the virus. And I don't think that would have changed much. I think what would affect the popularity of the president would be the way in which the COVID rollout has been handled. People think it's been much too slow. But, what's interesting is the EFF in particular has now taken the stance that the president has really bungled in terms of the vaccines, and that the lockdown isn't good enough now because we should have vaccines. But there's an interesting outcome in the survey, and that is that only 67% of adult South Africans are prepared to take the vaccine. So, and we need about 80 to 90% of South Africans to want to take the vaccine and to actually take the vaccine. So, vaccine immunity is not the only answer. I think that we need to be very careful in making sure that we follow the public health regulations, because we can't be complacent, not now. It's been such a long time. And the president said that often last night, we've suffered for a long time. We're almost at, we're at 15 months now of in and out of lockdown. And we're getting the vaccines, but not fast enough. But the vaccines aren't the magical cure for this pandemic. it's a real step in the right direction, and we can see in Europe it's working well. But at the same time, not all South Africans are willing to take the vaccine.
Professor Narnia, you touched on issues continentally, and as you said, sometimes it would be easy to kind of reduce the challenges faced by the continent to a vaccine shortage. But of course, the problems go way beyond that. We've seen increased levels of violence during the pandemic, the unemployment rate that was already high, skyrocketing, poverty, food security, these have been amplified by the impact of COVID-19. Have we seen any clarity in dealing with these sorts of problems at a continental level?
Well, what usually happens continentally and across the world is that you have a bigger police presence as well as a military presence. And that's not always a good thing. As we know from an incident in South Africa, many incidents, but in particular the death of someone who was beaten by the police during the lockdown at the beginning, during level 5. So yes, there is action taken. That this action is perhaps disproportionate and overzealous at times. But what was interesting to see was that no action was taken when the EFF had their march to SAPRA, weren't wearing masks and certainly weren't keeping social distance, but we didn't see the police take any action there. So it seems to be there seems to be some form of unevenness around taking the action, but I think states need to be very careful in ensuring that the action against the protests is not overly violent.
But how do we go about dealing with this? Because it's not just the EFF march. There have been other political occasions prior to this, outside court gatherings of ANC leaders, for example, where the same has happened. Do you think that the police have a clear indication of the role that they need to play? As you say, they don't need to be seen to be unnecessarily heavy-handed, but how do they go about enforcing the law, keeping people safe from themselves, as it were? Because it is mandatory to wear a mask, but if people are not wearing masks at these gatherings, what should happen?
Well, this is very difficult because if you have large groups of people not wearing masks, I mean, what does one do? So perhaps the best thing to do is to arrest, because it is illegal not to wear a mask in public, to arrest people who are leading these movements, these protests, such as the one that you mentioned outside the court as well, and many others. There's service delivery protests that have been happening across the country as well. I think that the problem is, we have a right to protest, but at the same time, this is a very dangerous thing to do. It could lead to cases spiraling, especially with the Delta variant. And so the police have the right to arrest people arrest people who are breaking the law. And they should do so. I mean, even if they can't arrest a whole crowd of people, they should certainly be arresting the leaders who are encouraging this kind of behavior.
And Professor Narnia, as we wrap this up, this, of course, was the first African COVID-19 Commission's meeting that was held last week after President Ramaphosa established it. What should we expect of this commission for it to be a success for the people of this continent? What would be the success indicators?
Well, I think, there's strength in numbers. As a continent, perhaps we'd be able to leverage the acquisition of vaccines more easily. I know that almost all the African countries, I think, are part of the COVAX. And so we could get vaccines at a lower price, perhaps. We could get more assistance from other countries. And I know there are other vaccines that are being tested at the moment. So it's really just about standing together. And this kind of unity could possibly lead to us being able to leverage the situation better than we have as independent or singular countries. So I like what is being done in terms of moving away from vaccine nationalism, standing together to ensure that the whole continent is protected.
Professor, we'll leave it there. Thank you so much for your time. Professor Narnia Bohler-Muller is from the Developmental, Capable and Ethical State Division at the Human Sciences Research Council, and talking there about President Ramaphosa's new role as the chair of the AU COVID-19 Commission, Africa Response and its associated responsibilities. So quite a lot to bite into, and what we have to basically do going forward as a country, and many interesting conversations being had about COVID, about the response to COVID at various levels. Have we done enough? Could we have done things differently? All of that is what we are grappling with, and hindsight, as they say, is always a perfect science. But much, much, much to ponder on, and much still to do. At the moment, let's just do what it is that we can do. Let's continue to practice social distancing and wearing a mask. It is mandatory, and washing our hands as often as we can. Please be safe. Please take care.